A proposal to cap out-of-pocket spending on insulin to $35 a month had failed to pass the Senate on Sunday. Now, Democrats over the weekend held votes on the Inflation Reduction Act, a plan negotiated by Chuck Schumer and Joe Manchin. During a session in which proposals could be added to the bill or removed, Republicans successfully stripped the proposed $35 a month cap from the tax and climate bill, which was sponsored by Raphael Warnock. So he sponsored this amendment. Hey, we should put a price cap on insulin. If you have insurance, you should not have to pay more than $35 out of pocket, period. Now, the bill, it was going to go through, and it did go through reconciliation. Now, reconciliation requires a simple majority, 50, right? With Kamala Harris being the tiebreaker. Now, unfortunately, this amendment, right, this proposed amendment to cap insulin costs was rejected by the Senate parliamentarian. Because, of course, in their opinion, it's not related to the federal budget and is not eligible for a reconciliation bill. So now what happened is that since they needed to, since it couldn't be in reconciliation, it had to be voted on by the full Senate and get 60 votes. 7 Republicans sided with Democrats to keep the insulin cap in the bill with a 57-43 vote. So it failed. They needed 10 Republicans. They didn't get 10 Republicans. Now, the 7 who voted with the Democrats were Senators Bill Cassidy, Suzanne Collins, Josh Hawley, Cindy Hyde-Smith, John Kennedy, Lisa Murkowski, and Dan Sullivan. So now, while they voted for the amendment, they all voted against the package as a whole. Now, the package as a whole actually provides something that's good. Actually, there's a lot of decent things in it. One of the provisions that did make it through, and it made it through the parliamentarian, is a $35 insulin cap for those who are currently on Medicare. So that's good and all that people on Medicare are able to save money. Now, the only issue, of course, is where's everybody else? What about everybody else? Is it fine to let these pharmaceutical companies price gouge you until you're 65? Well, that doesn't seem right to me. Now, according to the Kaiser Family Foundation, more than 1 in 5 users, insulin users on private insurance actually pay more than $35 a month for insulin. Some 7 million Americans require insulin daily. In fact, a Yale University study found that 14% of those insulin users are spending, get this, more than 40% of their income after food and housing costs on insulin, on medication. That is disgusting. 40%. 40%. So now here comes a sleight of hand from Republicans, right? Because again, they voted this down, so naturally you would expect Democrats to hit them on it, right? Now, Republicans instead pushed their own amendment. So here's what it did, or would have done. Apparently, the amendment would have had insulin available at federally qualified health centers. So, and for what they claim to be pennies in the dollar, which would have been paid for by redirecting existing money from the Obamacare Public Health Prevention Fund. Medicare and Medicaid statutes define an FQHC as a health center that receives federal funding under Section 330 of the Public Health Service Act to provide comprehensive primary care services to uninsured and underinsured populations. These centers, which receive federal funding, may either be public or private nonprofit healthcare organizations. So now, basically, Republicans wanted to give federal money, redirect federal money from the ACA to potentially private organizations and allow them to sell insulin. Oh, but it creates competition. It's competition. And that's it. We solved the problem. No, you haven't. You haven't solved the problem at all. Again, using money from the ACA. Now, the Public Health Prevention Fund, by the way, where they would take the money from, what it does is, I mean, it's fairly clear. It invests in prevention and public health programs to attempt to keep the costs of private and public healthcare from going up too fast. Now, you could argue that maybe it's not that successful because we still have healthcare that goes up, but what power do they have? They really don't have a lot of power because they're not able to have any leverage over private insurance companies. So, look, what the Republican plan was, though, was just, I don't know, take this money from something and we're going to shift it around, give it to these private organizations. We're going to let them sell insulin. Okay, and the Democrats said, no, that's too narrow. We're not in favor of that. And so the Republican response is to blame Democrats for not being able to control the price of insulin. In fact, here's Senator Ron Johnson tweeting this. Lying Dems and their friends in corporate media are at it again, distorting a Democrat gotcha vote. In reality, the Dems wanted to break Senate rules to pass insulin pricing cap instead of going through regular order, which would have failed and did fail. They put this in a bill. It wasn't allowed in, all for show. And again, they're talking about the parliamentarian, right? So again, the parliamentarian says that that's just not related. Funny, because Republicans didn't actually care about what the parliamentarian said when it came to passing gigantic tax cuts for the rich. Remember that? They fired the parliamentarian. This is during the Bush administration. They fired them and said, no, we're gonna do tax cuts for the rich anyway, using reconciliation. Yeah. Now, I think that Democrats should have gotten rid of the parliamentarian to pass this. Why? Because this is something that Americans desperately need. This is life and death here. Okay, you have millions of people that cannot afford their insulin that takes up so much, up to 40% of their income, for 14% of them. And no, parliamentarian says, no, can't do it. Sorry. And then Republicans turned around and said, I can't believe you tried to get it through the parliamentarian. Because what they did is that even though the parliamentarian said no, they left it up for a vote, but it still required 60 senators to vote in favor of it. And so, of course, Republicans said no. But here's more of what he said. I voted for an amendment that Dems blocked. This is Ron Johnson again. To provide insulin at low cost, cost to low-income Americans. Dems ignore the average out-of-pocket cost in the commercial market. It was $23 in 2021. So he said increased competition has led to price declines. It has not. Price controls lead to reduced supply availability and new drug development. What those are industry talking points crafted by big pharma CEOs. Look, it's no surprise that Ron Johnson is sitting here parroting industry talking points because that's who he works with. Chuck Grassley also claimed that he voted in favor of lowering the price of insulin, but it was the Democrats that didn't. In fact, he said, I voted to make insulin available for pennies on the dollar to uninsured with high deductible plans, but Dems blocked it. Again, Democrats blocked it because it wouldn't do anything to address insulin costs. No, what we need is a cap on how much they can charge out of pocket. Now, what's interesting about insulin is you look back into the person who discovered it, and he literally gave away the patent for free. Why? It's because he cared about humanity. He actually wanted to help people, not use it to make industry profiteers profit, money. And so what happened, though, is Big Pharma, they got a hold of it. They decided that profit was more important than people. And now we have lots of people who can't afford it. People that are dying because they can't afford their insulin. All these Republicans had to do was vote in favor of a modest price cap on copays. Again, meaning that insurance would have to take care of the rest of it. So now, why that would bring down the price is that you would have insurance companies that would be like, oh no. We can't pass this to our consumers. We can't pass it to the customers in premium hikes. Well, maybe they could, but maybe just hike premiums outside of that. But they still couldn't actually pass, or I'm sorry, they couldn't actually charge anyone more than $35 out of out of pocket for that particular medicine. And so what they would probably do is negotiate with the pharmaceutical companies, which is what they do already. And of course, they're going to do so to protect their profits. Now, Republicans, they do not want to they do not want to harm the profits of industries. They want to protect them. So they come up with nonsense solutions that won't actually have a negative impact on these big corporations. Now, when Democrats reject those non-solutions, they turn around and lie about it. And that's how the game is played. And I'm not saying, by the way, that Democrats are perfect here as well. They oftentimes also protect big pharmaceutical companies because, you know, they get paid by those companies too. Now, if the Warnock Amendment made it into the bill, look, that would have been a game changer. But once again, here you had the parliamentarian who was unelected that fucked over the American people and then let Republicans, on behalf of their donors, destroy the bill. Again, you can ignore the parliamentarian. Now, if Republicans could do that, as I mentioned with George W. Bush and the tax cuts for the rich to save corporations money, why couldn't the Democrats do that to save the American people money? Well, I mean, there's a lot of different answers to that, but I like to go with the most simple answer to that. And I'm saying if you want to find the right answer, all you have to do is follow the money. If you follow the money, it'll show you exactly why Congress votes the way that it does.